So it looks like we do have a patient for the night clinic. Perfect. And it looks like they are experiencing just a bit of a headache and nausea and wanted to just stay over at the clinic so that they could make sure their health was good. Okay, I'll have to check their stomach. And as soon as I did walk in here, it looks like they are sleeping a little bit. But I did hear their stomach just growl, so maybe that's a bit of flatulence, I don't know. But we will see and just give them a quick examination. Sounds good. So, just have to carefully wake the patient. Oh, it does look like they are drooling just a little bit. That's okay. And oh yeah, oh great heavens, it does look like their skin is somehow very dry and yet also oily. Make that make sense. Well, I'll have to just make sure that they're okay and check them and make sure that their health is good. So let's just carefully wake them. Hello there. Apologies for waking you, but you are overnight at Dream City Clinic, and I am the nurse for the night. My name is Nurse TMI. Yeah, pleasure to meet you. Oh, what does TMI stand for? Oh, it means too much information. You'll find out very soon why they call me Nurse TMI. Yeah. So, I do see here that you are here overnight at the clinic because you had a headache and a bit of nausea going on. I do see that, and I did notice your skin. I'm not gonna lie with you. Your skin is very dry and yet also very oily. Is that normal, or did that just happen because you've been at the clinic? Yeah, well, I'm gonna have to ask you a couple of questions based off of that alone. So just sit for just a couple seconds. I do have a little bit of a rare beauty. It's like an anti-oil blotting sheet. I'm just gonna put that on you. Yeah, just have to do this really carefully because you are a little bit greasy and somehow also crusty. Just sit there. I'm just going to and a bit on your nose now. Perfect. And it does look like the oil blotting paper got a lot of oil off, so you look a little bit less greasy, a little bit more dusty and crusty, but that is okay. I'm gonna ask you really quick, can you just say ah? Say ah. Yes, I can tell. So it does look like you have a little bit of bad breath going on. I'm going to give you just a little bit of gum before we proceed with the exam. And this is just for me. This is just for me. Okay. So just say, I got a little bit of gum. Good. And we're going to have to write a note in there that you're going to have to keep up with your toothpaste and toothbrush and floss. You know, I was going to write that down, but it's okay. I am not at all bothered by anything because I am kind of like the best nurse ever. Good. So, do you have enough pillows or blankets? Are you cold? Are you warm? Let me know how you feel right now before we begin. Good, you're doing great. Great. So, first what we're going to do is I'm going to get your temperature. Do you feel like you've had a fever or a bit of a chill in the past week or so? Okay, sit still. It looks like your temperature is doing great. Let's check one more time. And perfect, your body temperature is amazing. That is flawless. So I'm going to write that down. And I'm going to just carefully get a measurement of your eyes. Sometimes if you do have a headache or something where your head hurts a little bit, your eyes can fluctuate. But I'm just going to carefully measure your eyes, okay? Good. And could you look at me? Goodness, your eyes are gorgeous. Is that your natural eye color? Do you wear glasses or contacts? Fabulous. Your eyes look amazing. Take a look at me. I'm going to carefully measure with your eyes there. Perfect. And look at the center. Could you look at the center? Perfect. Looking at the center, it looks like that's perfectly measured. And it does look like your eyes are doing fabulous. You do not need an extra pair of glasses today. Isn't that fabulous? It totally is. And I'm going to start asking you a couple of very personal questions now, if that's okay with you. Good. So, when did you start feeling a bit under the weather? Yeah, were you eating any really good healthy foods? That's what I thought. I can tell just by your skin that you are not drinking enough water and you are not eating enough proper nutritious foods. I can tell. And also the did notice you walked in here with a water bottle, and this is adorable, but I'm actually going to use it for a quick eye exam, okay? What are these, by the way? These are from a video game. What video game? Animal Crossing. See, I'm not a video game person, but like you seem like the type. You did walk in here with like a bit of like a anime pajama pants. Yeah, I don't know what that is, but they're cute, I guess. Yeah. So no judgment, but full judgment. I'm gonna have to ask you to just do a little bit of a color assessment with your water bottle here. What color is this little cat? Good, that is a bit blue. Very good. And what color is this cat? That is pink. Very good. What color is this cat? Good, that one's yellow. Does this one remind you of anything? I bet it would. I bet it would. What color is this cat? This one is a bit gray. Okay, good. And what color is this cat? This one is also a bit gray. Very good. There is also no water in your water bottle. Again, I can tell by a bit of your dry skin, but we're going to move on with the exams now, okay? We're good. So, what I'm going to do is I'm going to get your heart rate. I have a stethoscope here, and these are freezing cold. I don't know what it is, but like every single equipment piece in the clinic is like ice cold. Our air conditioning just runs at like 60 degrees in here at all times, so like, let that be known. There's nothing I can do about it, but we're just going to get your heart rate, okay? Good, good, good. So, I'm going to ask you to relax, do full relaxation moment, and because you did have a bit of upset stomach problems, etc., if you would like to just do whatever you like to do, perhaps you'd like to flatulate, just relax, do whatever you gotta do, okay? No judgment. Good. We also have like air spray in here if that happens, so we're good. So I'm just gonna put this on your shoulders first to get your heart rate. Good, 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 good. Oh, your cheeks are getting a bit red. Are you okay? Oh, you're just a bit. Oh, yeah. It's okay. Just relax. Just a bit nervous. Yeah. Sometimes when I ask a bit of personal questions, people get a bit red in their face. Just a little bit of bright cheeks. Yes. So I'm gonna put this right there. I'm gonna ask you to breathe in, breathe out, and let loose. Good, good, good. Other side. I do see you already have goosebumps. I apologize, it is freezing. Good. Okay, good. Now I'm just going to do a little examination of the abdomen. Okay, just breathe in, breathe out. Good. Okay, so I did hear your stomach is working. Again, if you would like to talk about anything about the flatulence, you can. It is totally okay to let yourself relax and have a good time here, okay? I got you. Good. So what we're going to do now is I'm going to check your scalp, okay? And I'm just going to take a look through your scalp to see if you have anything going on there. And perhaps if you had anything going on with the skin right next to your forehead. Okay, I'm going to just take a quick look, okay? Is that okay if I touch your scalp? Good. I'm going to take a look. Okay, just going to just comb through there. Nothing there, no lice, no dandruff. Actually, a little bit of dandruff right there. And your hair appears to be quite healthy. I'm just going to take a quick look. Okay, very good. And I'm just going to put a bit of pressure on your forehead. Let me know if that bothers you or gives you any type of headache, okay? Good. Right there. Okay. So, next to your temples, it appears to be a bit sore, or perhaps you do have the headache going on. I'm going to write that down really quickly. And it also does look like your skin has a bit of acne. Are you following a regular like face wash regimen with like a face lotion, a toner? Yeah, we can really tell. So sometimes your skin can actually get a little bit more sensitive sensitive, especially during the sun, if you're not properly taking care of your skin. And I'm gonna just write them that you need some lotion. Yeah, maybe a little bit of face wash as well. That's okay. Good, good, good. So far, though, your health is looking pretty okay. I'm gonna carefully put a bit of pressure behind your ears, okay? Let me know if that feels okay, or if it causes a bit more of a headache. Good. I'm gonna put my hands right behind your ears, okay? Good. You look quite relaxed. Does that feel okay that I put a bit of pressure? Okay, what I'm going to do now is I'm actually going to test a bit of calcium behind the ear. I think this may get a little bit of the headache away, but I'm just going to tap, tap, tap behind the ears, okay? Good. So I want you to let me know if that feels okay first. Okay, we're going to start the tap in 3, 2, 1. Is that okay? Good. And good. Good. And did that feel like a bit of your ear felt a bit more in equilibrium? Good. Have you ever felt the signs of vertigo before? Kind of like you're on like a spaceship or a boat where it is swaying back and forth? Yeah, well, we as people also have that same thing where sometimes our balance can be thrown off, especially behind our ear due to calcium buildup. Do you lay down often on your sides? Are you a side sleeper? Me too. Can happen often with people who sleep on their sides. That's actually true. Yeah. Let's just see other ear now. Also, you do have a bit of earwax. You want me to remove that? No need to feel any sort of embarrassment. It's totally okay. I'll just remove that afterwards because it's quite a lot of earwax. Understandable. Do you listen to loud music? Yeah, what do you listen to? I have never heard of that, but it sounds interesting. Yeah. So, what kind of music is that though? Can you look here? Can you look here? Good, so you listen to like, okay, I've never heard of that. I like listen to like the radio. So I'm kind of more on the average music listener side, but if you listen to that, I mean like that's cool too. Yeah. You know, it's cool too. Yeah. Are you a fan of country music? Yeah, you seem like you would. Okay, so I'm gonna ask you just a quick sound test. Let me know if you hear this from your left or your right side, okay? I'm gonna put my hands behind your ears. Good. Let me know if you hear it from your left or your right side. Left or right? Good. Left or right? Good. Left or right? Good. Left or right? Fabulous. So it looks like the earwax is not stopping you from hearing any different. I thought it would. I'm gonna write that down. So I'm actually going to let you look at me first. Can you look over here? Can you look back at me? So your ears are actually connected to your face and the way that your whole body works. Sometimes if your ears are off, your eyes can turn from direction to direction. I'm just going to carefully clean your ears, okay? So I have a couple of tools here that we use to remove a bit of the ear buildup, the earwax, and this is a little bit of a scrape. I'm just gonna get that a little bit, okay? Good. Just gonna ask you to sit still. Oh yeah, that is. Yeah. Do you listen to like a lot of headphones with your headphones in? Do you fall asleep with your headphones in? Yeah, that can make it worse. Yeah. Oh yeah. And yeah, that is fantastic. That is out now. Perfect. You probably can hear in 3D, maybe even 4D. Perfect. Other side now. Perfect. And let's just remove that. I'm gonna ask you, I'm gonna whisper something in your ear and I want you to repeat it back to me. Okay? So I'm gonna just carefully whisper something in your ear. Repeat the word back to me. Sunshine. 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 And what was the word? Sunshine. Great. So your ears are now working in 4D, even 5D. That is so amazing. I'm gonna write that down. I am just that good. Can you look over here? Good. And your eyes appear to be a bit irritated and red. Do you have any like allergies, or perhaps you are someone who wears or gets too close to their phone? I can tell. You seem like someone who plays a lot of video games. Is that true? Yeah. No. I can tell. Yeah. And just a quick question based off of the prior information. Are you someone who plays like hours and like hours of games? Yeah, that's what I was expecting. I was gonna write that down. I'm gonna call it a video game player. Yeah. And I'm just gonna quickly show you something here. I do have a bit of a perfume, and what perfume does is it can make you smell like flowers, and currently you do not smell like flowers, and this is absolutely not based off of video game playing, but I'm just going to apply a bit of this over you, okay? Good. You get what I mean? Good. Perfect. I'm just going to let that set in. Perfect. Now you smell like flowers. Good. Oh, this is not because you play video games. I just like to add that so that you feel a bit more refreshed. This actually smells like fresh linen, like fresh laundry. And what this does is it's actually something that we apply here in the clinic so that you actually stay a bit sanitary. So it's like a small shower. It's nice. It's actually really good for you. Good. Very good. And just a quick question. How often are you someone who showers? Yeah, that's okay. I'm gonna actually give you a little bottle of this before you leave. Yeah, and I'm gonna ask you really carefully. I'm gonna ask you to follow the light for me with your eyes, okay? And I'm gonna just give you a little bit of a speed test. Follow the light. If you are someone who is constantly online, you probably have a lot of focusing that you can do, because when you are on your phone, there's a lot of things that you focus on. So I'm just gonna quickly test your focus. Keep looking at the light. Amazing focus. Look at that. Very good dexterity. Awesome. Looks good. Now can you look here? And can you look here? Can you look up? And can you look down? Is this your left or your right side? Good. Is this your left or your right side? Good. And what's closer? Is this closer 1 or is this closer 2? Good. Is this closer 1 or is this closer 2? 1. Good. Is this closer 1 or is this closer 2? Good. Is this closer 1 or is this closer 2? Hard to tell. Okay, so side by side is still a bit, needs a little bit of work. Okay, and just really quickly, I did notice that your lips are very dry. I'm going to give you just a little bit of a application of a lip gloss, okay? This one is actually very minty, so it actually will make your breath a lot fresher. Yeah, just like the gum, So, I'm going to ask you just to sit still. I'm just going to apply this. And can you do this for me? Perfect, one more time. And go like this. Perfect, I'm going to let you keep this. Yeah, just a couple of our self-care items we're going to give to you. I'm going to write that down as well. Yeah. So what I'm going to do next is I'm going to take a quick look inside of your mouth, especially if you're kind of feeling a bit with an upset stomach. So I want you to say, ah. Say, ah. Good. Looks like you have teeth. I'm very proud of you. Amazing. Good job. And it does look like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. About 28 teeth. That's super. I'm proud of you. Claps for you. Very good. Proud of you. And if you could just carefully just say, ah, good. Okay, and you can relax now. I'm going to carefully feel your lymph nodes. They're right actually underneath your jawline, so I just want you to relax, okay? Okay. And I'm just going to put a bit of pressure. 3, 2, 1. And relax. Got a bit of pressure. 3, 2, 1. And relax. Perfect. And a bit of pressure. 3, 2, 1. And relax. Do you feel any sense of sore throat, or perhaps any dry throat, or anything like that? Okay, so we're going to need to up your water intake. Yes, we do. I'm going to recommend 60 ounces of water a day. That is actually at the minimum. And this is going to be good to keep your skin hydrated, which you need, to keep all of your health doing well, which you need, literally, and to keep you healthy, which you need. We need to make you feel like 1,000% because you deserve it, and that's what we're here for. And I'm also going to increase the amount of toothpaste that we're also going to send home with you. Yeah. We are going to talk about you and the bathroom. Interesting topic, correct? Good. So, have you had any problems going to a restroom? Do you know what I mean? I mean this about number one, and most importantly for you, about number two. So, do you have any problems with that? Okay, because we could also get samples. Yeah, I'll just write that we need samples in the morning, okay? And any troubles with that at all? Yeah, I did notice you said earlier that your diet, your food that you were eating was like not the best. So what I'm going to do is I'm going to write you a super awesome food regimen that's going to make you feel okay and like yourself again, okay? And I always recommend a lot of cauliflower and like totally a lot more water, especially for you, my little dry skin friend. Yes. Okay, what I'm going to do now is write that down and just going to ask you very closely. Do you have anything going on with your work or your school? If you do that, that could be putting a lot of unnecessary stress on your life. Yeah, because I also see that you have these very large under eye circles that make you look very tired, and I did see that just for you. You are looking a bit more tired than I would normally think. Could this unnecessary stress be causing you to feel a bit more not like yourself? And that's okay. Thank you for being honest and letting me know. And now, how many delicious drinks do you have a day or a week? And I'm talking about like juice, like orange juice, or something like cranberry juice, or like soda. Are you a Mountain Dew fan? You seem like a Mountain Dew fan. I want you to stop that. You know why? It's not good for you. Limit the amount of soda that you drink and maybe have it be like 1 or 2 a week at maximum. Got it? Good. I'm just gonna get a quick sample of your ear and just a little bit on the side of your cheek, okay? And what we do with this is we're actually going to send this in to make sure that you have nothing going on, like a stomach flu, something like that, okay? You're doing so good. I'm so proud of you. And like, honestly, thank you for like dealing with a bit of my intense questioning. I am just known for it. Okay. So first I'm gonna get a sample of your ear, okay? I just want you to relax. And I'm gonna send that in. And then just a sample from your cheek. Can you say ah one more time? Good, just going to. Okay, sending that in. And the reason why I am is because sometimes a lot of earwax, ear buildup, and a stomach problem can be more than we imagine. And sometimes it can be something that we can take care of with just a little bit of medicine. You know what I mean? Okay. So, just to summarize now, looks like your health is doing okay. I did notice that you are just having a bit of more stress, which we're going to relax and reduce because you deserve to feel like fantastic, and you deserve to feel like amazing and wonderful, okay? Because you are. Let's get that ready. As well, I'm going to send you home with a little bit of deodorant, a lot of deodorant, toothpaste, a bit of a little shower spray, some lotion, and I'm going to send you home with just after this little check here, I'm going to send you home with just a little bit of a medicine to make sure that your stomach feels okay. Okay? Good. Thank you so much for being here today at the clinic. Again, I am Nurse TMI, and you passed all of the tests with like flying colors. And again, thank you for just sitting here and relaxing and letting me question you. Yeah, you deserve it. Okay, so we're gonna check you in the morning, and then we're gonna let you just relax and, go home. But we're going to send you with the results of what we talked about today, how we can improve XYZ, and we're going to make sure that you feel great